Hi there, my name is Rachel Karchmer-Klein. I am your instructor for EDUC 436, and today I'm going to provide you with a quick overview of response to intervention as well as a review of literacy assessments. RTI is part of the 2004 reauthorization of the Individuals with Disabilities Education Act. It is based on the theory that some struggling readers have not had sufficient opportunities for learning. And the legislation itself is designed to give students multiple opportunities to learn before referring them for special education testing. Torgerson in 2003 said if students do not receive high quality initial instruction and do not have available to them reasonable interventions if they struggle in the classroom, then far too many students will be judged to have learning disabilities. So response to intervention is a process that measures whether a learner's academic performance improves when they are given a well-defined, scientifically based curriculum and intervention. Students who respond to this curriculum and intervention are far less likely to have a disability. There are three major components of RTI that are extremely important for you to know. First, is high-quality initial instruction along with small group instruction that is differentiated according to student needs. You can see right there with using the term differentiated how RTI relates directly to this class. So high-quality initial instruction can be conducted both whole group and small group. We'll talk a little bit more about that in a few minutes. Second component of RTI that's critical is reliable screening and progress monitoring to identify students who are falling behind. And quite frankly, these types of measures also help us identify students who need to be challenged, which we'll talk more about next week. Interventions for struggling readers is the third component of RTI, and these can be provided by the classroom teacher, the reading specialist, and sometimes, depending upon financial need, a paraprofessional tutor. Along with the three components of RTI, what you really must know about it are the three tiers. In this particular course, EDUC 436, you're going to hear me talk about tiers in two ways. One is in relation to RTI, and one is in relation to designing differentiated instruction lesson plans. In relation to RTI, there are three tiers. The first tier is high quality instruction related to the curriculum goals. Tier 2 are special interventions provided by the classroom teacher, and Tier 3 is the identification and qualification for special ed services. I'm going to talk about each one of these. Tier 1 starts out by administering screening assessments to the whole class. These assessment results then guide your instructional decisions. They will measure growth over time for students. So for example, a lot of screening data is given at the end of a school year and then also in the beginning of the school year. Screening data measures individual students' achievement compared to their grade level peers. It measures progress related to specific benchmarks. And then finally, it identifies students who are at risk for academic failure. In relation to Tier 1 instruction, it's important to keep the following things in mind. Instruction must be conceptually rich and challenging, delivered through a whole group instruction typically. It must build knowledge, skills, and strategies. It is typically linked to national and state standards, which for now would be your Common Core state standards, especially if you're in the state of Delaware. During Tier 1 instruction, all children in the classroom participate in the same set of activities. So you're looking at the same standards, you have the same learning goals for all students in the classroom during Tier 1 instruction. During this time, many times you'll see direct instruction from the teacher, then you may see some group work, as well as individual practice and assessment. Finally, high-quality whole group instruction plus some small group support should be adequate to support almost all children who begin the year on level. So this is Tier 1 instruction. Tier 2 instruction, in relation to assessment, is focused on progress monitoring data. And I'll talk a little bit more about what progress monitoring is in a few minutes. but it's used to determine how and when to change the intensity or type of intervention that you're going to provide to a student. And it also provides teachers with data that they need to improve their instruction. We'll talk more about that in a few minutes. Tier 2 instruction is more complex and targeted than Tier 1. It tends to include differentiated instruction. Children many times will work in small groups, and one group at a time will work with the teacher. It takes place in the classroom, and when we're talking about literacy, it's during the reading block, but if you're in a content area, then it's during your content area time. All students also participate in Tier 2, and this is very, very important to think about. It's not only a time for students who are struggling with a concept to receive that small group instruction by the classroom teacher. It's also a time for those kids who need to be challenged. And we're going to talk a lot more about those kids in the coming weeks. But so all students are participating. One group may be accelerated and receive challenging work. Another group may receive extra attention to the current lessons because those students may be near or at grade level and they just need a little bit more reinforcement. And then, of course, we also have students who may need reteaching of previous skills and strategies because they're struggling with whatever that concept is. So during Tier 2 instructional time, there's still a lot of work that needs to be done. Tier 3, in terms of assessment, teachers administer progress monitoring data to students a little bit more frequently. These, again, assessments guide instructional decisions. In terms of instruction, this is even more targeted instruction for those children whom both Tier 1 and Tier 2 are just not working. The instruction tends to be systematic and explicit. It's aimed at preventing the need for special ed services. Depending upon the school, it may take place outside of the classroom and outside of the reading block and be conducted by reading specialists, paraprofessionals, or someone else. And what is unique about this tier structure is that if the student is still struggling after receiving support in all three, Tier 1, Tier 2, Tier 3, if the student still cannot perform, he or she is then referred to determine whether or not they're eligible for additional services. So let's talk about tests. I know that you've had classes related to tests, assessment measures already, so a lot of this will be a review, I'm hoping. First of all, we have assessments that are both can be group administered or individually administered. Group administered tests are more time efficient, clearly. One literacy assessment that you may think of is the Words Their Way spelling inventory. That's something you should have talked about in 210 and or 310. And those assessments can be given to the whole class at the same time. Individual tests are given when oral responses from students are necessary. This, for example, could be the DIBELS, which requires a student to respond directly to the test administrator. Individual tests tend to provide more dependable results because you're working one-on-one with the child, and you can get, whether or not the student is understanding the directions, understanding the tasks, so on and so forth. We also have formal versus informal tests. Formal tests have clear-cut directions. For example, the DIBELS. You're supposed to just read what those test instructions are. You're not supposed to read them differently than what's printed in the instructor's manual. Formal tests are scored in a carefully prescribed manner. Teacher's discretion or teacher judgment doesn't come into play. A state test is an example of a formal test, and an informal test does allow for teacher discretion. Something like the Words Their Way spelling inventory. So, for example, you're reading something and you think the student spelled it right, but you really, that the student, writes the letter G backwards all the time. So you're not gonna, you're still gonna count it as correct in that particular Words Their Way spelling inventory, whatever. An informal reading inventory is an example of an informal test. We also have norm reference versus criterion criterion reference tests. Norm reference tests compare one child's performance to what might be normally expected of other children. And then criterion reference tests evaluate the child's mastery of certain competencies. As related to RTI, we have 4 ways of using tests. So screening, I mentioned this earlier. Screening tests are used to determine children who are likely to require additional instructional support to succeed. We tend to give them early in the academic year or when a new student comes in or enters into our classroom. All students are typically given screening measures, and they're most valuable when used to identify children who may need further assessment or additional instructional support. Diagnosis assessments are very useful because they provide specific information on skills and strategy needs of individual students. So whereas the screening measure might just tell you generally a student doesn't know all of his letters of the alphabet, a diagnostic assessment will tell you which letters the student doesn't know. Diagnosis or diagnostic assessments follow screening or at points during the year when students are not making adequate progress. We give them to students by once indicated by a screening or progress monitoring measure or by teacher's judgment. And they, again, provide specific information. Progress monitoring you should hear a lot about as well. These are frequent, timely measures to determine whether students are learning critical skills. So for example, say that you give a screening assessment and you identify the fact that a student doesn't know all of his letters. Most screenings don't ask every single letter of the alphabet, for example. They'll just ask, I don't know, a handful of them. So you find that out, and then you give a diagnostic and you find out exactly which letters of the alphabet the child doesn't know. Well, then you take a couple of days to really focus on those particular letters and have the student play with the letters and write the letters and think about the letters and pick them out and so on and so forth. And then you may give a progress monitoring assessment that follows up to see whether or not the student has learned that particular concept. Progress monitoring are given a minimum of 3 times a year. And they can also be given at any critical decision-making points. They're given to all students, and they're not just used for students who are struggling. And they indicate students who require additional assessment and timely intervention. Finally, we have assessments that we use for accountability. The purpose is to determine level of proficiency in relation to a norm reference population or a criterion. They're typically administered at the end of the year. They can be administered pre-post to assess overall growth. All students are required to take these, and they provide an index of overall efficacy, but there's limited timely information for instructional decision making. So for example, a lot of times at the end of the year, the teachers give their state tests, but the results come really whether they be at the end of the year or in the summer, and therefore they can't really be used for immediate instructional decision making. The question then is, how do you choose an assessment measure? Well, typically your school's going to tell you which assessments you're going to use, especially formal ones. They're going to identify ones that allow you to predict with accuracy students who will later have difficulties. When you're choosing an assessment, you want to keep in mind that you want to choose ones that are going to tell you specific skills you need to teach. And another helpful tip is that you want to choose an assessment that has multiple forms. And that way you can follow up and administer the assessment again, perhaps a week later or a month later, to see whether or not the student has benefited from whatever focused instruction you're providing. So this has been an overview of what RTI is. We are going to talk much more about assessments in the coming weeks and also differentiated instruction and how it relates to RTI. Thank you.